Chemotherapy, most chemotherapy drugs cause all dividing cells to die, and since the mucous membrane are composed of rapidly dividing cells, these tissues do not replenish during the intense therapy. Mucous membrane form a barrier against infection, and without them, the mouth can become inflamed and opportunistic bacteria, yeast, fungal infection can occur. Chemo also affect the ability to salivate. يعني السلالة will be also affected, causing plaque to build up rapidly, thus increasing the incidence of gum infection and cavities. Chemo can cause drop in absolute neutrophil count, which makes it harder to fight off infection. Low platelet count means that bruising and flossing can cause bleeding. In children, development of the teeth can be adversely affected by radiation and intensive chemotherapy. فهذه المشاكل اللي ممكن أن يسوي لنا إياها الكيموثيرابي، يأثر على السلايفة، يأثر على النيوتروفيل، يأثر على البليتلت، يأثر على التشيلدرن اللي هم التيث في مرحلة development also will be affected. Before chemotherapy begins, what we need to do in the dental office. Patient should have thorough examination, at least 1 month prior to chemotherapy. Pan and full mouth X-ray, periodontal evaluation, oral exam for cancer screening. لأن بعض البلاك هي cancerous أو precancerous لازم نcheck, identify and treat existing infection carriers and other compromised teeth and tissue injury or trauma. Stabilize and realignment potential site for infection. Conduct prosthetic evaluation if indicated. If a removable prosthesis is worn, make sure that it is clean and well adapted to the tissue. Instruct the patient not to wear the prosthesis during treatment, if possible, or at least not to wear it at night. Schedule dental treatment in consultation with the oncologist to do the filling. Schedule oral surgery at least 7 to 10 days before myelosuppressive therapy begins. Perform oral prophylaxis if indicated. Smoking cessation. Studies have shown that smoking interferes with some chemotherapy treatment. Smoking slow recovery. Smoking can cause recurring head and neck cancer. Oncologists may not want the drug used to help with the smoking cessation. Patients need to quit cold turkey, يعني النرجيلة بصورة عامة. Chemotherapy. The oral complication of chemotherapy depend upon the drug used, the dosage, the degree of dental disease, and the use of radiation. احنا قلنا انه الكيموثيرابي احيانا مو وحدها وانما يكون composition with radiotherapy. فالcomplication تزداد كل ما ازداد الكمية والدوز، إضافة إذا كان أكو radiation وياها. Chemotherapy carries a significant risk for mucositis. Consult an oncologist before conducting any oral procedure in the patient with the hematological cancer. Do not conduct a procedure in patients who are immunosuppressed or have thrombocytopenia. Thrombocytopenia معناه low platelet count. Question to ask the medical oncologist. What is the patient's complete blood count, including absolute neutrophil and the platelet count? If an invasive dental procedure needs to be done, are there adequate clotting factor? Does the patient have central nervous catheter? What is the scheduled sequences of treatment so that safe dental treatment can be planned? Is radiation therapy also planned? Complete blood count and chemotherapy. عندنا النيوتروفيليا اللي هي low neutrophil count. الأنيميا تعرفوها. الثرومبوسايتوبينيا هي low platelet count. نجي during chemotherapy. Consult the oncologist before any dental procedure, including prophylaxis. Ask the oncologist to order blood work 24 hours before oral surgery or other invasive procedure. Postpone when the platelet count is less than 5730 per millimeter cubic millimeter or abnormal clotting factor are present. هذا يصير postpone the treatment. Absolute neutrophil count is less than 1000 per cubic millimeter or consider prophylactic antibiotic. During chemotherapy, the oncologist may want patient to be seen by the dentist more often than every 6 months. دائما الأونكولوجيست خلال مراجعة المريض دائما ينصحه أن يشوف الدنتست خلال هاي الفترة. فزياراته راح تكون أكثر من المريض العادي اللي هو كل 6 شهور. هذا ممكن كل شهر كل شهرين يجي يراجع. Due to the lack of saliva راح يكون عندنا lack of saliva. The plaque builds up faster, therefore cleaning may be every 2 months, and check for mouth sores and decay. If ANC اللي هي absolute neutrophil count, white BC count permitting. Emergency treatment can be done with any hematological status to remove source of infection. Work with oncologist if count under 40,000. Consider platelet replacement. Use chlorhexidine prior to treatment and after can help cut down the chance of infection. Try to schedule dental work few days prior to chemotherapy. This is the time when the patient feels best. After treatment, they are weak. During chemotherapy and radiation. To prevent mouth sores, antibacterial mouth rinses اللي هي دائما alcohol free لأن alcohol is irritant. stannous fluoride ومشتقاته. During chemotherapy, antifungal mouth rinses can be used. Patients under intense chemo are at risk of fungal and yeast as well as bacterial infection. Nystatin to prevent fungal infection can be used to prevent or to treat. Mycostatin أو nystate rinses, swish and swallow because these infections can be in the throat passage as well as in the mouth. Mycelex lozenges. عندنا المهم في جماعة الكيموثيرابي during هو الثراش اللي هو fungal infection. is the most common mouth infection during chemotherapy. Use ultra soft brush so patient does not damage tissue. Run under warm water. Change toothbrush every 3 months or after any infection. Floss at least once a day, and you can use water pick on lower setting. الوتر بيك should be avoided لأنه يسوي injury. هو أساسا عنده ulcer. Toothpaste should be mild gel. Stay away from strong flavor like mint, cinnamon, and do not use whitening toothpaste. If toothpaste irritates the patient's mouth, use mixture of half teaspoon of salt with 4 cups of water. Gargle regularly with solution made up of 1/4 of plain water, half teaspoon table salt, teaspoon baking powder, or sodium bicarbonate. Identify and eliminate source of oral trauma and irritation such as ill-fitting denture, orthodontic bands, and other appliances. Identify and treat potential oral problem within the proposal radiation field before radiation treatment begins. Instruct the patient about oral hygiene. Educate patient on preventing demineralization and dental caries. Check for oral source of viral, bacterial, or fungal infection in patients with fever or unknown origin. Encourage consistent oral hygiene measures. Consult the oncologist about the need of antibiotic prophylaxis before any dental procedure in patients with central venous catheter. Sores in the mouth occur because the cells of the mucous lining are not replaced as quickly as needed due to the chemotherapy. هذا شوفوا تأثير الكيموثيرابي لأنه تأثر على الخلايا السرطانية بنفس الوقت تأثر على الميوكس لاينينج سيلز فبالنتيجة تؤدينا إلى sores or lesion can occur even in the absence of bacterial or fungal infection, but once there, they should be treated with antibacterial agent to prevent infection. Glutamine helps and lessens the mucositis. نجي special drugs which are used in conjunction with chemotherapy and radiation therapy اللي هي البايفوسفونات drug used in chemotherapy. هذه مشكلتها شنو؟ نسوي لنا osteonecrosis of the jaw. Is a condition that has been observed in cancer patients who undergo invasive dental procedures such as dental implant or tooth extraction while receiving treatment with intravenous biphosphonate or by irradiated bone. ONG can cause severe, irreversible, and often debilitating damage to the jaw. بمعنى أنه المريض اللي يجيكم أثناء المعالجة أو حتى بعد المعالجة وتسألوه من الهيستوري إذا كان ياخذ بايفوسفونات دراج اللي هي conjunction either with chemotherapy or with radiotherapy هنا نخلي بالنا مشكلة osteonecrosis of the jaw ONG وحتى بالراديشن نسوي لنا osteoradiocrosis ليش؟ لأنه can cause severe, irreversible and often debilitating damage to the jaw. وهذه صورة للأوستيو radio and osteonecrosis of the jaw either due to chemotherapy or radiotherapy in conjunction with biphosphonate. Chemo for breast cancer. تعرفون إنه البريست كانسر يستعملون وياه chemotherapy or radiation or surgery. يعني after breast cancer, chemo patient may be placed on estrogen reducer drug, fumarate, and then on IV biphosphonate. عندنا هنا بالبريست كانسر two drugs داخلا ويا التريتمنت مالته هي البايفوسفونات والاستروجين reducing drug. So we have to be careful عندما ناخذ الهيستوري ويطلع عند الفيميل اكو breast cancer and is treated by estrogen reducing factor or biphosphonate. After chemotherapy, once all complications of chemotherapy have resolved, the patient may be able to assume their normal dental care and schedule. However, if immune function continues to be compromised, determine the patient's hematological status before initiating any dental treatment or surgery. This is particularly important to remember for the patient who have undergone stem cell transplant. Ask if the patient has received intravenous biphosphonate therapy. Complications specific to chemotherapy. Neurotoxicity, provide analgesic or systemic pain relief. Bleeding, advise patient to clean teeth thoroughly with toothbrush, soften and warm water. Avoid flossing the area that are bleeding, but to keep flossing to the other hand. And I suppose not to use the flossing and toothpaste. نجي الهيد and neck radiation therapy. Radiation, some people who get radiation to the head and neck, sometimes chest areas, have redness and soreness in the mouth, and dry mouth, trouble in swallowing, changes in the taste, nausea. Other possible side effects include loss of taste, earache, ear aches, يعني وجع بالأذن, and swelling of the jaw, stiffness, and jawbone changes. Patients receiving radiation therapy to the head and neck are at risk of developing oral complication because of the risk of osteonecrosis and radiation field. Oral surgery should be performed before radiation treatment begins.
العفو دكتور.
Patient. نعم.
بس الشاشة متى تتغير على السلايدات اللي انتوا تقروها يعني تشرحوها؟
مو طلعوها على التليفون مالتكم، على الموقع.
نعم دكتور.
يطلعوها على الموقع وتابعوا الكلام. لأن أنا أقرأ لكم إياها من غير حاسبة. Okay. Prior to head and neck radiation, patient should have thorough examination at least 1 month prior to the radiation treatment. وهي هاي نفسها بالكيموثيرابي also يعني pan and full mouth X-ray, periodontal and oral examination for cancer screening, identify and treat the existing infection, carriers, other compromised teeth and tissue, injury or trauma, stabilize and eliminate potential signs of infection, extract teeth in the radiation field, لأن التيث اللي هي non-vital or compromised in the radiation field is difficult to be extracted during the treatment So we have to extract it before starting the treatment with radiation, or may pose future problem to prevent later extraction, which may induce osteonecrosis. Conduct prosthodontic evaluation if indicated. Prevent tooth demineralization. Demineralization يعني due lack of saliva. فشو يصير عندنا demineralization ويكون ready to be curious. هذا شلون نتجنبه؟ حقيقة هو preventive measure، جماعة البريفنشن يعرفوها. فإحنا as a dentist ما نبدي نحول كذا، وإنما أكو أشياء عامة ممكن نستعملها اللي هي prevention with fluoride, sodium fluoride or fluoride gel, and any other type of preventive measure. The instruction, this is depend on the preventive measures. ما يخص الأورال سيرجري له at least days 14 days of healing for any oral surgical procedure. يعني المريض بعد 10 أيام يتعرض إلى راديوثيرابي أو كيموثيرابي أو كذا، فالمفروض إحنا نعطي مسافة أطول إذا قررنا أن نسوي له extraction or any type of treatment. فلذا دائما المريض أو الكيمو أو الراديوثيرابي نشوفه قبل شهر من conducting the treatment. Conduct prosthetic surgery before 3 months, since elective surgical procedures are contraindicated on irradiated bone. يعني إذا يحتاج إلى تكون prosthodontic أو prosthetic surgery لازم نسويها قبل ما يتعرض إلى التريتمنت. ليش؟ لأنه قلنا it is contraindicated، يعني elective treatment in the phase of treatment is contraindicated. الأسئلة اللي ممكن أن نسألها للأونكولوجيست أو الراديشن. What parts of the mandible or maxilla and salivary gland are in the field of radiation? أجزاء الفم أو الماندبل أو الماكسيلا أو الساليفري جلاند اللي راح تكون ضمن حقل الراديشن، لأن احنا قلنا إنه الراديشن والكيموثيرابي not selected for cancer cell، وإنما يصير تعريض للمنطقة ككل، فتتعرض الخلايا الطبيعية والغير طبيعية للدستركشن، وبالتالي تكون نتائجها على الاريا ككل is abnormal. What is the total dose of radiation patient will receive, and what will be the impact on these areas? الراديشن طبعا هم بدوز وبفريكونسيز.
وصلت الباسورد ما عندي.
أنا رابط على الراوتر.
ما عندي واير.
لا
ما في واير.
لا تعبان.
طيب.
إيه.
رحمة الله.
لا. What part of the mandible or maxilla and salivary glands are in the field of the radiation? What is the total dose? Has the vascularity of the mandible been previously compromised by surgery؟ يعني المريض إذا كان مسوي previous surgery والفاسكولاريتي متأثرة به، فلازم نخليها ببالنا هاي ويا الأونكولوجيست. How quick does the patient need to start radiation treatment؟ يعني هل هو مستعجل الحالة أو تحتاج وقت؟ نقدر نسوي other treatment هذه. النقطة الأخرى will there be induction chemotherapy with radiation؟ نسأل إنه هذا راح تسوي له radiation راح تسوي ويا induction لأنه إحنا قلنا treatment of cancer may be composed of chemotherapy and radiotherapy لأن كلها يتأثر على مصير الخلايا اللي بالاريا مالتنا. During radiation therapy, monitor the patient oral hygiene, watch for mucositis and infection, advise against wearing removable appliances during treatment. After radiation therapy, recall the patient for prophylaxis and home care evaluation every 4 to 8 weeks or as needed for the first 6 months after cancer treatment. Reinforce the importance of optimal oral hygiene. Monitor the patient for trismus. Check for pain or weakness in masticating muscle in the radiation field. Instruct the patient to exercise 3 times a day, opening and closing the mouth as far as possible without pain. Repeat 20 times. Consult with oncologist team about the use of denture and other appliances. After mucositis subside, patient with friable tissue and xerostomia may not be able to wear them again. Watch for demineralization and caries. Lifelong daily application of fluoride gel are needed for patients with xerostomia. Advise against elective oral surgery on irradiating bone because of the risk of osteonecrosis. Tooth extraction, if unavoidable, should be conservative using antibiotic coverage and possibly hyperbaric oxygen therapy. هنا اكو بعض الادراجز اللي تستعمل to protect salivary tissue against radiation damage. يعني مرات indicated مرات not indicated بس الدمج هو يصير. What are the common side effects of radiation? Reduces resistance to bacteria, viral and fungal infection, and مثل chemotherapy, which allows them to become opportunistic. Dry mouth, altered taste, sensation, include burning sensation, sore stiff jaw, damage to the teeth, swallowing difficulties. Demineralization قلنا نسوي كاريز بس المشكلة اللي تيجي اللي هي التريزماس تيشو فايبروسيس لأنه يصير ديستركشن للمسلز فيسوي لنا فايبروسيس وبالنتيجة هتنطينا تريزماس. Instruct the patient on stretching exercise to prevent and reduce the severity of fibrosis. Osteonecrosis, avoid invasive procedure involving irradiated bone, particularly the mandible. الادفايس هو البراشنج والفلوسنج of the teeth but with minimal force and minimal trauma. النقطة المهمة دائما احنا نوصف الماوث ووش او الماوث جارجل بالكيموثيرابي دائما وابدا avoid mouth washes containing alcohol. إذا كان عنده dry mouth ننصح sip water frequently, suck ice chips or use sugar-free gum. Use saliva substitute spray or gel or prescribed saliva stimulant if appropriate. Avoid glycerin swabs. Exercise the jaw muscle 3 times a day to prevent and treat jaw stiffness from radiation treatment. Avoid candy, gum, and soda unless they are sugar-free. Avoid spicy, acidic food, toothpicks, tobacco products, and alcohol. Test changes refer the patient to a dietitian. Each animal advised the patient to rinse mouth with water and baking soda solution after vomiting to protect animal. Special care for children. Children receiving chemotherapy and or radiation therapy are at the risk of the same oral complication as the adult. Other action to consider in managing pediatric patients include the following. Extract loose primary teeth and teeth expected to exfoliate during cancer treatment. This is important. Loose primary teeth and teeth expected to be exfoliated حسب الجدول مالتها. إذا كان ضمن فترة المعالجة لازم نسوي له extraction لأن يصير exfoliation during treatment راح يصير عنده complication. Remove orthodontic mounds and brackets if highly stomatotoxic chemotherapy is planned or if appliance will be in the radiation field. Monitor craniofacial and dental structure for abnormal growth and development. Hemopoietic stem cell transplantation. Most stem cell transplant patients develop acute oral complications, especially patients with graft versus host disease. Also, in such cases, the same applicable for chemotherapy and radiotherapy. Before transplantation, conduct pre-treatment health examination and prophylaxis. Consult oncologists about scheduling dental treatment. Schedule oral surgery at least 7 to 10 days before myelosuppressive therapy begins. Prevent tooth demineralization and radiation caries. Instruct the patient in home application of fluoride. Instruct the patient about oral hygiene regime. After transplantation, consult oncologist before any dental procedure, include prophylaxis. Monitor the patient's oral health for plaque control, tooth demineralization, and dental caries and infection. Watch for infection or on the tongue and oral mucosa. Herpes simplex and Candida albicans are common oral infection. Delay elective oral procedure for 1 year. Follow patient for long-term oral complications such as problem are strong indicator for chronic graft versus host disease. Monitor transplant patient carefully for second malignancies in oral cavity. What is mucositis? Mucositis refer to breakdown of the mouth tissue. يعني مثل الألسر. ليش تصير؟ قلنا لأنه الكيموثيرابي الراديوثيرابي تأثر لنا على الجروث أوف ذا سيل، فريبليسمنت ما راح تصير، فراح تبقى على شكل uncovered area اللي هي ألسر. It can range in severity from red sore mouth and gum to open sores in the mouth. Chemotherapy and radiation therapy kill not only the cancer cell, but other rapidly dividing cells, including the lining of the mouth and the throat. Oral mucositis leads to several problems: pain, nutritional problem, inability to eat, increase the risk of infection due to open sores in the mucosa. What are The signs and symptoms of mucositis: red, shiny, swollen mouth and gum, blood in the mouth, sores in the mouth, soreness or pain in the mouth, difficulty in swallowing, feeling of dryness, mild burning or pain when eating, soft whitish patches or pus in the mouth and tongue, increased mucus or thicker saliva in the mouth. Who gets mucositis? من اللي راح يصير به mucositis? 40% or more patients who receive chemotherapy will develop some degree of mucositis. Patients receiving radiation to the head and neck, chest, patients who undergo bone marrow or stem cell transplant are at greater risk, about 80% of developing mucositis. Certain chemotherapy agents are more likely to cause this side effect. يعني بعض الكيموثيرابي المستعملة أكثر تسوي، بس هي عموما لو نحسبها إنه most of the patients develop mucositis who treated with either chemotherapy or radiotherapy. Course of mouth sores. Not every undergoing treatment for cancer develops mouth sores. مو الكل يصابون، لكن النسبة العالية جدا يصابون. First day, no noticeable change, but injury is accumulate. 3 to 5 days after treatment, damage to genetic material in the mouth cells, soft tissue start to feel warm. 7 to 10 days after treatment, inflammation and sores appears. During the treatment period, sores can become painful and infected. Eating and swallowing can become difficult. 2 to 9 weeks after treatment, sore heal and disappear. There are 3 stages of oral mucositis. First, inflammation. Ministerial inflammation. This is accompanied by painful mucosal erythema, which can respond to local anesthetic. Painful ulceration with pseudomembrane formation, and the case of myelosuppressive treatment, potentially life-threatening sepsis require antimicrobial therapy. Pain is often such intensity as to require treatment with the parenteral opiate or analgesic. Stage 3, spontaneous healing occurring about 3 weeks after cessation of anti-neoplastic therapy. What does it looks like? هذه صورة عندكم للألسر. It's like any ألسر، بس من الهيستوري نعرف البيشنت إنه هذا عنده كانسر ولا لا. What early intervention stages should the health team follow? The team should begin care planning, here preventive measure. Patient receiving chemotherapy, radiotherapy, or in the chest, head, and neck area should have their mouth checked daily for redness, soreness, or sign of infection. The individual develops fever, temperature greater than اللي تعرفوها 37 أو 36 ونص, with some of or all the above side effects. Implement protocols as soon as possible. Contact oncologist. Pain control, cryotherapy, second on ice chips has some effect on pain management. Mucosal protectant work by coating mucosa, forming protective barrier for exposed nerve ending. There are some drugs that protect against the damage to mucosa. They have demonstrated that they reduce dry mouth and may prevent mouth sores. In pain control, ibuprofen أو brufen and over-counter analgesic. pain شو راح يسوي لنا؟ راح يسوي لنا pain causes stress, depression and fatigue. It can ruin in quality of life and slow progress towards better health. بالنسبة للأوبيات are important tool, but it is contraindicating to be prescribed from the dentist. It should be prescribed by oncologist. Oral care for chemo and radiation, moisturizing the lips at least 2 times up to 6 times daily. Use dry mouth product at least 2 to 6 times daily. Rinse mouth before and after meals and at bedtime. Saline solution, soda, water without alcohol, non-alcohol fluoride rinses. هاي قلنا ضمن preventive measures, but we have to organize for the patient. Use an ultra soft toothbrush after meal and bedtime. Use gauze and washcloth if the patient has difficulty in swallowing, or ANC and white BC count are low. Dental mouthwash, dental floss, lemon or glycerin swab, hard, no, hard or medium brush, toothbrush, no petroleum-based product for the lips care because of they can promote infection. Do not use water pick during treatment. Nutritional and lifestyle intervention. Increase fluid. Include food high in protein in the diet. Avoid hot, spicy, acidic food, alcohol, and hard, coarse food. Do not smoke cigarettes. Do not use smokeless tobacco, chewing tobacco. Let food cool to room temperature. Moisten food with gravy if difficult to be swallowed. هنا عندكم جدول what to eat, what not to eat. كل شيء written should be not eating during the treatment. هاي صورة الأوفر كاونتر برودكت اللي موجودة في كل بيت ممكن استعمالها في حالات الكانسر treatment. Points to be remembered. High dose of radiation treatment carries lifelong risk of xerostonia, dental caries, and osteoporosis. لأني 3 أشياء جدا مهمة لازم نتذكرها وهي المريض اللي عنده cancer. So our treatment depends on the phase in which is the patient is. Because of the risk of osteonecrosis, principally in the mandible, patients should avoid invasive surgical procedures, including extraction that involve irradiated bone. If an invasive procedure is required, use antibiotic, hyperbaric oxygen therapy before and after surgery, and should be lifelong daily fluoride application. Good nutrition and continuous oral hygiene are especially important for patients with salivary gland dysfunction. Dentures may be needed to be constructed if treatment altered oral tissue. Some people can never wear denture again because of friable tissue and xerostomy. Dentists should closely monitor children who have received irradiation to craniofacial and dental structure for abnormal growth and development. Dentists should be mindful about the recurrence of malignancy in patients with oral and head and neck cancer and thoroughly examine all oral mucosal tissue at recall appointment. Chemotherapy radiation treatment both pose a problem with dental treatment. Mouth sore can be extremely painful, cause malnutrition and delay cancer treatment, and can cause serious infection. The oral cavity usually goes back to normal after chemotherapy, but has lifelong complications after head and neck radiation treatment. يعني الفارق بين الكيموثيرابي والراديشن، الكيموثيرابي المريض ما يتعالج ويقطع العلاج ممكن ان يرجع التشو الى طبيعته، لكن بالراديوثيرابي راح تسوي لنا permanent changes in the oral tissue، وبالنتيجه انه it is not reversible. Dental appointment should be scheduled 2 days prior to chemotherapy when the patient feels best. Dental exam should be scheduled 1 month prior to chemotherapy and head and neck. هاي الإجراءات اللي قلنا نسويها before. النقطة الثانية المهمة وهي always work with oncologists and their staff. He or she is the primary care provider. If you are unsure of treatment, always ask the oncologist. You can refer the patient out to the specialist for emergency dental work, and you can refer patient to oncologist for most medicine needed in the mouth infection. You should know what your role is, working as the team with the best way to help your patients recover. بالنسبة للبيشنت, do not lecture the patient on oral care. هاي انتم بالبريفنشن واحنا دائما انه لا تحاضر للمريض، احكي له باللغة اللي هو يستوعبها حتى توصل الى نتيجة ايجابية. ليش؟ لانه هو في داخله وفي داخل تفكيره هواي من الامور اللي متمشكل بها وتعرفوها اجتماعيا. اي مريض يقول له انت مصاب بالسرطان راح 100 حسبه وحسبه تجي، فانت من تحكي وياه بلغه المحاضره ما راح يفتهم منك شيء. الافضل انه تحكي باللغه اللي هو يتفهمها ويقتنع بها حتى يقدر يتبع وصاياك. encourage good oral hygiene. تريد تكتب الهياب، تريد تعلم الهياب بشكل مباشر، تريد تكون على استعداد للتواصل مع المريض. هذه هنا عندكم الويب سايت للمراجعة والريفرنس. الطلاب، سمعتوا المحاضرة؟ منو عنده سؤال أو شيء مستوعبه؟ فليتفضل. ألو ألو ألو.
نعم دكتور، وياك على سيدة.
أنا اللي أريده مثل ما حكيت لكم من البداية أنه أي موضوع هو من ندخل بتفاصيله متشعب كثيرا، لكن نريد جوهر المحاضرة. جوهر المحاضرة هو أنه شو راح تسوي لنا الكيمو الراديوثيرابي، تأثيرها على الخلية، نوت ان ديتيل بس كأوتلاين، وبعدين الفيزات مال المعالجة، لأن المريض راح يجينا قبل المعالجة وأثناء المعالجة وبعدها. وقلت لكم جزء من الأشياء اللي تسويها مو عامة لكل هذا، وإنما خاصة، وهي جماعة الباي فوسفونات، لأنه هذا اللي ياخذ باي فوسفونات كونوا حذرين منه، نسوي له اكستراكشن راح يصير عنده بون نكروسز وإرفيرسبل تشينجز. فهنا الاكستراكشن يصير اندر كير، وبنفس الوقت اندر تريتمنت اوف هايبرباريك اوكسجين. يلا نحصل الا غير هاي انه نتركه انه يطيب وحده، ترى ما يطيب. منو عنده بعد سؤال؟ الامتحان مالكم انتم حددتوا، امتحان مال الفصل انتم حددتوا المحاضرات الداخله به الثلاثه اللي قبل هاي ما داخل. تفضلوا. بنين أسامة عبد الحسين. الو. بنين أسامة عبد الحسين. زهراء عقيل. حسام ياسر.
نعم دكتور.
موجود. مو ترى اكو قسم من عندكم داخلين بس هم ما موجودين. آمنة نبيل شهاب. آمنة نبيل شهاب. نعم. فاطمة مسلم كاظم.
نعم دكتور.
دكتور اللي سجل يطلع؟
مو عندكم بعد تكملة المحاضرة اللي هي عن كورونا فيروس.
دكتور هاي داخله بالمنهج الكورونا؟
ها؟
كورونا داخله بالمنهج يعني ضمن شو اسمه لو فد شيء اكسترا يعني
بمن
تعطينا اياه بالمنهج مالتنا والامتحانات والهاي.
هي طبعا شلون.
وهو يعني ما اعرف انا هو غير مرض جديد يعني معقوله موجود بالمنهج يعني لو فد شيء اضافي.
هو لازم ابديتنج احنا نسوي.
تمام شكرا.
اي ابديتنج ويا الحاله. انا بصراحه دا احكيها لكم لسبب مهم قبل ما ادخل بالديتيل مالتها، انه توصيات عامه وانا موصيكم اياها بالعملي، انه المعالجه لاي مريض من تشتغل عليه لازم تلبس ديسبوزابل جاون. فهواي
اشتري
من عندكم ما دا ينفذون الشغله ودا يصوروها مساله سهله. لا، هي لمصلحتكم ومصلحه المريض، وهي كونتمبراري واندمج تشوفون المشاكل مالتها.
تمام
فاحنا
اشتري دكتور.
إيه، فاحنا لازم نستمر بالاجراءات اللي هي بسيطه وبنفس الوقت تحمينا وتحمي المريض. فما اريد مريض واحد يشتغل عليه بدون قام كامل. ماشي.
تمام دكتور ماشي.
فحتى أعطيكم فرصة المحاضرة ان ديتيل حتى يجوز استتعبتوا من هاي المحاضرة. المحاضرة القادمة راح تكون عندكم هي بالموقع موجودة عن الكورونا فيروس والبريكوشن مالته ان ديتيل. ما راح نطب لأنها صارت مسألة معروفة إعلاميا وموجود كل شيء واحد يقدر يبحث عن الكورونا فيروس. بس نريد إحنا كشغل مالتنا المهم بي هو how to protect ourselves and the patient, our colleague, from the infection. من تستعمل شيء disposable تخلص ذبة. إذا تستعمل صدريتك وحتى الستراب أو كذا، فهذا راح يصير أي كونتاكت راح تاخذه وياك بالجنطة ببيتك وكذا ممكن أن يسوي لك انفكشن. ماشي طلاب، عندكم شيء بعد؟
لا دكتور كل شوي عاش ايدك.
يلا مع السلامة.
مع السلامة.
دكتور والحضور.